Hey, y'all. Today I want to talk about a topic that is a little controversial. And, it's something that we've been telling patients for a really long time when we're looking at their imaging about giving them a specific diagnoses. And some of these diagnoses, particularly in the lumbar spine with lower back pain, persistent lower back pain, patients will come to me with diagnoses like lumbar disc herniation, degenerative disc disease, facet arthropathy. And what I want to share with everyone is that, these diagnoses can sound really scary. Degenerative disc disease, like I have a disease, and I want to give you peace of mind and let you know that a lot of times our scans will show wrinkles on the inside. So what I mean by that is, right, we get wrinkles on the outside, just a little bit in our eyes, our, cheeks, maybe other places, and they don't hurt, do they? So what happens is when we start aging, we get wrinkles on the inside. So there are so many studies showing that people who have no symptoms at all, they do an MRI or an X-ray of their spine, and over 60% of them show one of these diagnoses that I shared: disc herniation, degenerative disc disease. We all have some sort of wrinkle on the inside as we age, even starting as early as in our teenage years and into our 20s and 30s, and of course 40s, 50s, and upwards. So the reason I want to share that with you is because structural damage does not always equal pain. There, again, so many studies right now showing that if there is something going wrong on the imaging report, a disc, disc disease, or lowering of the disc space, disc narrowing, and things like that, don't correlate very well to pain. And I want to share this with people because I think it really provides a lot of hope. I think there's a lot of fear and a lot of unknown when patients are getting these diagnoses. They don't understand the science behind it and the studies that go behind it. Of course, we want to be able to correlate, and we want to be able to tell the patient why they're having pain, but just by looking at a picture doesn't give the whole story. I'm not saying that your pain isn't caused by these issues. I'm saying that it might not be. And it's really important to look at all of the evidence, of where your symptoms are, how often they come. If there's some sort of quote unquote damage, the pain is going to be very specific. It's going to be very consistent. When I turn, it hurts here. When I move, it hurts here. It's going to be with specific movement patterns. And a lot of times, more than 90% of the time, when patients come to me, especially after they've been to different physical therapists and tried different treatments, they are their symptoms don't really present that way. They present with, the pain moves around, or the pain just comes without any specific movement, or does, every time I walk over a certain amount of time, my back starts to hurt, but sometimes it's on the right side, sometimes it's on the left side. So I want to share this information to make sure that we all have the knowledge of this. And it's really important that, we don't get these diagnoses and start to get super worried, because then when we start to worry that we have this structural damage, number one, we lose hope that our body can improve and heal itself, which it can. And also, there's a lot of fear that comes with that. Oh, I have a disc bulge, and then it's kind of like you're tied to this diagnosis. And, even that visual of like the bulge pushing on the nerve, and it's like shows like a lot of these models will show that it's red. And, there's a lot of fear that goes into that. So what I want to make sure that everyone comes away from this video with is that it's not always about structural damage. And the beauty of this work is that we work with our nervous systems, we work to regulate our nervous systems, we work to unlearn these pain patterns that we've had using the concepts of neuroplasticity, which says our brains are plastic and moldable. We can actually unlearn pain. And, there's been, so many studies too of people who have had these major structural issues and they still have them physically, but they don't have the pain. So just understand that the pain is not always originating from the area that we think or know to be damaged. So I just want to open your eyes and open our brains to the possibility that we can relearn and reteach our bodies to not live in pain.